On behalf of the 47 county governments, I take this opportunity to thank His Excellency the President for his continued leadership during this period. We appreciate the support extended to the counties, the National Treasury for releasing 10.3 billion grants from the World Bank to support various programs in the counties. We further thank the Treasury through the Ministry of Health for releasing allowances for health workers amounting to 2.3 billion. And also, we thank the government through the Ministry of Agriculture for writing off Kenya shillings 62 billion owned by the sugar companies in various counties. Fellow Kenyans, as we continued in fighting against the pandemic, we undertake to support the directive by the President during the 9th State Address on the coronavirus. Indeed, we support the first reopening of the country, which happened the other day. However, we must remain vigilant by implementing the guideline issued by the Ministry of Health. In the past few days, we have witnessed the number of positive cases recorded averaging 200 per day. It is therefore evident that the disease is spreading at an accelerating rate. This points to the need to intense effort by both levels of government and other stakeholders to confront the pandemic. At the same time, it points to concerted effort for individual responsibility, failure of which the control of the disease will be impossible and fatal. Only yesterday, we witnessed a very sad death of a Kenyan who was driving himself to seek help and never managed to get to hospital. He collapsed immediately. He got out of his car. Condolences to his family. Community health volunteers need to be supported to enhance outreach. The country is open and movement is highly increased, so response needs to be swift, timely, and effective. In the past 1.5 weeks, the 47 county governments have addressed the following. 1, status of isolation beds in the counties. Cumulatively, 26 counties have complied with the President's directive of attaining 300 bed capacity in its isolation facilities. The remaining 21 counties are working towards achieving the same by 22nd July 2020. They are all at different levels of preparedness. Secondly, 38 counties have trained additional 846 health workers, bringing it to a total of 19,177. Further, an additional of 1,247 community health workers have been sensitized, bringing the total to 64,283. We appreciate the efforts put in place by partners to train sensitized health workers and community health volunteers. We urge all partners to now more than ever reach out and provide practical support directly to the counties. As we all know and can see, it is government that is responding to this process, not partners. We urge you to channel your support to county governments. Number 3, active quarantine facilities. 38 counties have reported on the status of active quarantine facilities. There are 933 people in active quarantine facilities. 382 people who are confirmed to public quarantine facilities have been released. In the last 1.5 weeks, the general decrease in the number of people in the quarantine facilities have been attributed to the uptake of self-quarantine. Cumulatively, in 46 counties, 3,970 tests have been carried out. Number 4, recruitment of health workers. So far, the health workers who are supported by the government, 8,680 human resource staff have been recruited and already reported to their workstation in counties, except in 5 counties where they are finalizing the process. However, by the end of July, a cumulative total of 9,858 health workers will be on board. Fellow Kenyans, I wish to note that counties that have been dealing with COVID-19 from March 2020 have shared their lessons on how to confront the disease and minimize the mortality rate while increasing the rate of recovery. In today's statement, I will share with you and other county governments lessons learned by county governments who have dealt with the pandemic first. Lesson 1, training of health workers. Training of health workers has proved to be an effective measure toward the fighting against the coronavirus. County government should embrace continuous training of health workers as well as community health volunteers on the management and response to COVID-19. Lesson 2, provision of adequate quarantine and isolation facilities. Functional quarantine and isolation facilities are critical in addressing the pandemic. This has enabled effective response to the pandemic. In dealing with the expected upside, all county governments should up their game in ensuring these facilities are properly running and expedite the completion of the minimum 300 bed capacity. Further, each county needs to pay attention to setting up of a functional ICU and HDU to respond to COVID-19 cases, separate from the normal ICU and HDU beds to care for patients in critical condition. Number 3, strengthening of county-specific health systems and facilities. From experience, it is emerging that those who fall sick from the pandemic will most likely be attended to in the counties where this happens. This being the case, it is important that each county strengthens its systems and ensure the facilities can provide the requisite services to respond to the disease as modeled by the Ministry of Health experts. Lesson 4, ensuring availability of pharmaceuticals and non-pharmaceutical supplies. Availability of essential medical supplies is key in responding to the virus. Medicine must be available especially for individuals with underlying medical conditions. In addition, availability of non-pharmaceuticals of good quality is key in protecting the healthcare workers who will in turn confidently attend to COVID-19 patients as it reduces the risk of transmission of the virus. Lesson 5, ensuring preventive and promotive healthcare services. Capitalizing on preventive and promotive healthcare services through community health platform is a key measure in stemming the spread of the virus. We therefore urge the members of the public to continue implementing the guidelines issued by the Ministry of Health. Lesson 6, continuous engagement of communities and advocacy on COVID-19 prevention measures. Community engagement is an enabler to effective contact tracing and capping the spread of the virus. Community sensitization and advocacy is thus paramount in quick response to contact tracing. Lesson 7, strengthening disease surveillance system. Nyumba Kumi initiative has proved to be so effective in disease surveillance system. Therefore, counties need to utilize this system for early detection, trace, and response. This system proves to be effective in generating quality data for timely public health intervention. Lesson 8, enhancing testing capacity of COVID-19. It is important to undertake continuous testing, especially for healthcare workers. County governments have continued to test workers attending COVID-19 patients after every 2 weeks. Lesson 9, adequate allocation and mobilization of additional resources to support COVID-19 response interventions. The resources at the disposal of county governments are not adequate to enable waging a war to confront this pandemic. Therefore, county governments must partner with development partners, private sector, and other stakeholders to push their response measures. Delay in the disbursement of funds can be catastrophic and precipitate and a policy kind of situation in dealing with COVID-19. We therefore urge the national government to ensure the disbursement to counties are effected without undue delay. Challenges. Ignorant of COVID-19. Number 1, the number has now proven to be to all and sundry that the virus is here with us and we must exercise caution. My fellow politicians, the political class has been singled out by the media as the most unconcerned and reckless in this fight, second only to the youth. I urge all politicians, including myself, to lead by example because we are not immune by virtue of being politicians. Let us support the president by keeping safe. We have done it before and we can do it now. To all Kenyans, I once again reiterate that what has been said before. Number 1, wear your mask correctly as it reduces the risk of infection by 80%. Maintain social distance as it reduces risk of transmission by 75%. If you need not go out, please stay and work from home as it reduces the risk by 100%. Let us ensure strict adherence to the guidelines issued by the Ministry of Health for us to win the war. There has been a challenge of dissemination of information to the public on COVID-19. As we embrace home-based care, I urge all county governments to ensure that the training of home-based care starts from household level to those affected by the virus will be taken care at that level. It is therefore paramount that every household is trained in a language they understand. Please not caregiver, even at household level, are both men and women. I urge all the FM stations, especially vernacular stations, to take this challenge and train Kenyans on home-based care the same way students are being tutored. Dedicate 1 hour each week as FM stations and disseminate information to Kenyans in a language that they understand best. County governments are ready to partner with you to provide the information and attend your programs. Non-availability of testing cartridges. Lack of infrastructure for mass testing has obscured the true reflection of the spread of the virus, therefore posing a risk of increased community transmission. Despite the availability of general expert machines in all counties, testing has been hindered due to lack of cartridges. We cannot contain this virus if we do not expand our testing. Contradictory results. The results have emerged that are contradictory as an immediate risk and a rollback on the fight against the virus. It has made the citizens begin to think that their myth is true. This needs to be urgently addressed. As I conclude, as we continue to put in place measures geared towards the containment of the virus, we must continue to implement physical distancing and sanitation. All counties must ensure that public places are well equipped with sanitation facilities as preventive measures as paramount towards capping transmission of the disease. That's all I had, ladies and gentlemen.